Michelle Cotterman, welcome. Thank you.
Good evening, Chairman Wingham, Vice Chair John, Ranking Member Kelly, and honorable members of the State and Local Government Committee. Thank you for considering my proponent testimony on House Bill 90, which will allow for the legislative oversight of the governor's executive orders, certain public health orders, and emergency rules. My name is Michelle Cotterman. I am a mother, and my daughter did want to accompany me today as a homeschool lesson on our civic duty. I am also a registered nurse, a natural health professional, and a sovereign human being who lives in the state of Ohio. It has been a very unfortunate yet eye-opening experience over the last 10 months, which has brought a series of significant problems to light. Primarily, we learned that through a 100-year-old statute, the governor and the health department have unilateral power and ultimate authority when it comes to issuing orders related to public health states of emergency. Ohioans watched as these orders were issued without any input from the legislature. We watched as the judicial branch, despite rulings that the orders were unconstitutional, were ultimately ignored by the executive branch and unelected health department. I am concerned that the governor and the health department have tunnel vision and have vastly ignored indirect outcomes of economic and social burden, including deaths resulting from lockdown. The increased stress from economic hardships leading to increased drug overdoses, suicides, domestic violence, and the inability for Ohioans to receive non-essential health care has led to an increase in indirect deaths related to COVID-19. On May 21st, 2020, the Association of American Physicians and Surgeons wrote a letter to former Vice President Mike Pence and then chair of the United States Coronavirus Task Force. The letter was signed by hundreds of physicians and medical professionals. In the letter, they state, "Our patients have suffered needlessly in pain and physical decline with disease progression because of short-sighted government edicts to stop all non-emergency care that is unrelated to COVID-19. Some patients now face inevitable death because the diagnosis and treatments were delayed too long. Too many of our patients have suffered far more from the psychological, physical, and economic effects of the shutdown of communities and businesses than the direct impact of COVID-19 itself." A new study by authors at Duke University, Harvard Medical School, and the Johns Hopkins University Business School has concluded that the unemployment spike and recession caused by the response to the pandemic can jeopardize population health for the next few decades. They found that over the next 20 years, 1.37 million more people will die than would have died without the unemployment shock the pandemic response caused, and that these deaths will disproportionately affect African Americans. Likewise, the Health Policy Institute of Ohio found in its 2019 report that Ohioans face poorer health outcomes, including those that have lower incomes or education attainment. They define barriers to being healthy: a job that pays a self-sufficient income, quality housing, and increased exposure to adverse childhood experiences. Undoubtedly, we can see all of these effects multiplied as a result of the response to the pandemic. I am also concerned that the governor accepted advice solely from a small group of professionals who are only trained in pharmaceutical-based allopathic healthcare methods when directing his response to the pandemic. It is highly probable that these experts and their associated medical trade organizations have financial relationships with the medical device and pharmaceutical industries who seek to profit from the outcomes of their advised direction. There is unfortunately much potential for extensive corruption, pay-to-play politics that holds the balance of lives and livelihoods of Ohioans in its grip. I would like to see a wider panel of experience included during the decision-making process when it comes to future pandemic response in the state of Ohio. I believe that it is time for an overhaul of this over 100-year-old law, and House Bill 90 will achieve these much-needed changes. The government has an ultimate duty to uphold and protect our God-given, constitutionally protected rights, which includes an established checks and balances system on all branches of government. Ohioans are increasingly growing tired of the unilateral decisions that are tone deaf to our concerns, have cut out the legislative branch and ignored court rulings stating the administration's orders are unconstitutional. It is time for the legislature to dial in the powers that have allowed this overreach to occur in the first place, and I urge each and every one of you to please vote yes on House Bill 90. Thank you.
Thank you. Thank you for your testimony. Will you take questions at this time from the committee?
Absolutely, if there are any.
Okay, Representative Kelly.
Thank you, Mr. Chairman. Thank you for coming in. I know we've heard a lot of testimony specifically about the health orders, but this legislation goes even farther to other agencies. So I wasn't sure if you had any concerns or if you are specifically just sort of focused on the role of ODH in this and haven't given any consideration to the idea of other agencies as well.
Chairman Wiggum, Representative Kelly, thank you for the question. It is my understanding that there is similar language that is already in some of these emergency orders that would allow for concurrent resolution through the General Assembly to be able to interfere with those emergency orders.
Follow up.
Thank you, Mr. Chairman. And this actually is on a different issue. I know that we've had a number of folks insinuate, or talk about the idea of pay to play. And obviously in the People's House, we should be doing everything on the up and up and honestly and transparently and in the light of day. So I guess I would just say, if there actually is evidence of that, then it should definitely be taken to the Attorney General or to an attorney or to somewhere. So, I mean, I think if there is evidence of it, then we should certainly look into it because, I mean, obviously we've had our stumbles along the way here in this legislature over the past few years, but I would just encourage the witnesses that if you do have evidence that this is actually going on, then I would say you should give it to somebody so it can be fully vetted so we can determine whether or not that is true.
Chairman Wiggum, Representative Kelly, thank you so much for pointing that out. And I absolutely agree with you on that. I think that, as citizens, we do have a due diligence to, if we see something, say something. But beyond that, sometimes the backdoor deals and the corruption is so secluded that we don't have an opportunity as citizens to observe that kind of behavior that's happening that is, malice towards us as individuals. And again, like I said in my testimony, I would draw significant concern when we're talking about the only solutions being a medical device or a pharmaceutical product when we are taking only expert testimony from those who seek to profit from the use of those products. But thank you.
My question would be, if I may, my question is, do you think that House Bill 90, having a process in which the governor's office, administration, health department, make an order based upon the pandemic emergency powers, and then we go through a review process such as this, which hasn't happened except for Senate Bill 311 or Senate Bill 1. We've never had these type of discussions before on any of these orders in the People's House. Do you think that process would bring transparency to the table to have all sorts of conversations, such as whether there's connectivity between X or Y and whether or not some epidemiologists are not at the table or constitutional lawyers are not at the table?
Chairman Wiggum, absolutely yes. I think that allowing the public to comment on any committee proceedings will allow to have more voices available at the table, similar to what we're doing here today, allowing the public to have a voice. We haven't been afforded that over the last, we're coming up on the 1-year anniversary of the 2 weeks to flatten the curve mantra that we were told at the very beginning of this. And I can speak personally for myself, not only as a medical professional, but as a natural health professional and as a mother. We were all very concerned in the beginning of this. We all listened to what the health department and the governor were saying because we were very troubled and concerned about, this potentially infectious disease that was being presented to us and was affecting us. But as the time went on, many of us started to wonder, why are we still doing this? We've seen flip-flopping from our federal health experts like Anthony Fauci. Wear a mask, don't wear a mask, wear 2 masks, wear 2 masks with pantyhose over your face. These are literally the things that the Centers for Disease Control and Prevention, who are supposed to be our leading authorities on this, are telling us to do. And as individuals, it's very confusing to have to hear and navigate through all of this information that's being presented to us. So I absolutely think that House Bill 90 and creating this new committee will allow a greater voice that is more effective on our local environments. And then we can sort of, as Ohioans, be able to sort through all of those weeds and figure out what's best for us as a community. So thank you for the question.
Representative Creech.
Mr. Chairman, I don't know if I have a question or a comment, but we just had a doctor in here that's for House Bill 90, and now we have an RN back to back. And I find that ironic because where I come from, the medical professionals are not wearing masks, and they're not going to get the COVID shot, just like me. And so I just, I guess, what's the mindset when we're talking to medical professionals? That's what you are. What's the mindset? Why aren't you going to get the shot, and why are you here in support of House Bill 90 as a medical professional?
Through the chair, through the chair, Representative Creech, I really appreciate that question. And it is not my position to stand here today to tell any one of you what you should or shouldn't do and what products you should or should not consume. My personal conviction as a nurse has always been to meet people where they're at and to respect their individual choices when it comes to in the informed consent process, and to really support them in the decision that they're making. So I cannot speak today what I would say to somebody, because I wouldn't say anything to anyone as far as what I think they should do. I would point them in the direction for where they could find information. I may even pull out the product insert and talk to them about how this product is not approved by the FDA, but has been only granted emergency use authorization, which means that it is in a product that has no liability. So if something happens to you as a result of consuming this product, you're going to be on your own. And we have seen in the news a lot of side effects that are coming up through the consumption of this product. And I think it is important and imperative for each individual to take that information and to weigh it when they're deciding whether or not they are personally going to consume that product. Thank you for the question.
Representative Kelly. Okay. Representative John.
Chairman Wiggum, thank you so much for being here. So just to clarify, given that you are an RN, do you feel that you are more qualified to make a decision about this for yourself and your family than the state government?
Through the chair, Representative, is it Jones? Johns, thank you so much for that question. I think that I am the primary expert when it comes to my own body, my own self, the children that I'm raising. I live with them every day. I know what they've had for breakfast, lunch, and dinner. I know what kind of allergies they might have. I know everything about them. They're my children. And therefore, I do not believe that it is the government's authority, an employer's authority, or anyone else's authority but my own as a sovereign human being to decide what products or what directions I'm going to do. So I think that ultimately it should always be down to the individual, whether you're going to wear a mask or not wear a mask, whether you're going to consume a product or not consume a product. I mean, we've always done this, right? We have always been individuals and autonomous in our decision making every day. There's no reason why anything should be different now. And thank you so much for the question.
Okay. Representative Grindell, do you have a question?
I don't have a question. Just thank you for that very powerful testimony. And I believe in education of our young people, and to bring your daughter here, if you would have her maybe stand up and say her name, but to watch the process and to see a very brave mother fighting for her family. Thank you.
She's very shy, so she may not feel very comfortable with that. But her name is Amara, and she's 12 years old. And she wanted to come here tonight in order to see the process of what it is that I do so often, and also what it means to be a responsible citizen in the state of Ohio. Thank you so much for the recognition.
Seeing no other questions, thank you again for your testimony.
Thank you. Have a good evening, everyone.